Good afternoon, Ma'am Nicole. I'm your nurse for today, Joanne Leslie Dasan. So I'm going to perform the procedure together with my patient. So before doing the procedure, I'm going to sanitize my hands using ethyl alcohol.
Inspect the lips. Observe lip consistency and color. Put on gloves and retract the client's lip and cheeks to check gums for color and consistency. Then next, inspect the lower gingiva or gums. Inspect the buccal mucosa. Use a pen light and tongue depressor to retract the lips and cheeks to check color and consistency. Then inspect intestine ducts or the parotid ducts, openings of the parotid salivary glands, located on the buccal mucosa across from the second upper molar. Inspect and palpate the tongue. Ask the client to stick out the tongue. Inspect for color, moisture, size, and texture. Observe for fasciculations or fine tremors and check for midline protrusion. Then palpate any lesions present for induration. Assess the ventral surface of the tongue and use a pen light to inspect the ventral surface of the tongue, frenulum, and area under the tongue. Then observe the sides of the tongue. Use a square gauze pad to hold the client's tongue to each side. And palpate any lesions, ulcers, or nodules for induration. Check the strength of the tongue. Place your fingers on the external surface of the client's cheek. Check the anterior tongue's ability to taste. Place drops of sugar and salty water on the tip and sides of tongue with a tongue depressor. Note odor while the mouth is wide open. Note any unusual or foul odor. Assess the uvula. Apply a tongue depressor to the tongue or halfway between the tip and back of the tongue and shine a pen light into the client's wide open mouth. Inspect the posterior pharyngeal wall, keeping the tongue depressor in place. Shine the pen light on the back of the throat. After assessing the mouth with my patient, I remove my gloves and discard it. Then I sanitize my hands and I use another pair of gloves. Inspect the nose and check patency of airflow through the nostrils. Inspect the internal nose. To inspect the internal nose, use an otoscope with a short wide tip attachment, or you can also use a nasal speculum and pen light. Palpate the sinuses. Then palpate the maxillary sinuses by pressing with thumbs up on the maxillary sinuses. Percuss the sinuses, lightly tap over the frontal sinuses and over the maxillary sinuses for tenderness.